Hi everyone, my name is Christina Draganich, and I'm a physical medicine and rehabilitation resident at the University of Colorado. Today I'm going to be telling the story of how I became fortunate enough to become involved in the RSVP Free Clinic and how the clinic and I have grown together over the past 6 years. My journey to becoming a physician started at Craig Hospital. After I finished my degree in neuroscience at Colorado College, I wanted to learn more about applied science, and so I became a neurorehabilitation technician at Craig Hospital, working with patients with spinal cord and brain injuries. Little did I know that I would not only meet the individuals who would inspire me to go into medicine, but also the providers with which I would co-found a free clinic. During my work as a tech at Craig, I saw illness demand varying levels of patient reinvention, and it was an honor to aid in the physical care of these individuals whose tenacity and perseverance taught me about the human capacity for loss and adaptation. Working as part of a multidisciplinary team of providers to support these individuals' journey to recovery solidified my decision to apply to medical school with hopes of one day becoming the leader of that team. As I worked as a tech at Craig and applied to medical school, I had the fortune to be placed on Dr. Berliner's team, the physician who became my mentor and inspired me to become an osteopathic physician. I was also lucky to meet Dr. Niehaus, who became another important mentor in my life as he was a rotating resident at Craig at the time. We all loved our work at Craig, but saw a gap in the community for individuals whose injuries did not meet criteria for a rigorous inpatient rehabilitation stay. Individuals who require rehab after traumatic injury comprise a diverse and a vulnerable population. The Emergency Medical Treatment and Labor Act requires any individual who comes into an emergency department to be screened and stabilized. However, there is no such requirement for rehabilitation. Therefore, individuals without insurance are less likely to receive rehab after catastrophic injuries and more likely to discharge directly home after acute care, resulting in increased risk of secondary complications, including life-threatening complications such as sepsis and pressure injuries, and not to mention decreased quality of life. In 2015, along with Dr. Berliner and Dr. Niehaus, I helped to form a group of dedicated therapists, nurses, social workers, and physicians to open a free rehabilitation clinic. Dr. Berliner had already helped to co-found the first Rehabilitation Services Volunteer Partnership, or RSVP Clinic in Houston, Texas, which provided helpful guidance as we started the initial process. Our mission was to create outstanding rehabilitative care that maximizes independence, wellness, and community participation for uninsured individuals with spinal cord injuries, brain injuries, strokes, and amputations. And our vision was ability for all. The journey from inception to opening day was long, as we had to learn how to create a 501c3, write our bylaws, build a quorum of volunteers, and build the organizational structure of our clinic. We first established a board of directors, which included a president, chair, vice president, secretary, and treasurer. We then created a leadership council that consisted of different roles needed to make the clinic run logistically, including a volunteer coordinator, patient navigator team, and equipment coordinator. Together, we formed our bylaws and our 501c3. We gathered volunteers through talks and email blasts at local hospitals, volunteer drives, and volunteer submissions on our website. We also did this through word of mouth. We advertised our services to patients in a similar manner via connecting with social workers at local hospitals and through form submissions on our website. We also had to develop our admission criteria, which included being uninsured and having a diagnosis of either spinal cord injury, brain injury, stroke, or amputation. Our clinic is all volunteer-based, so we don't pay staff. However, we need approximately $7,000 per year for insurance, including board and liability insurance, as well as malpractice insurance. We needed to fundraise approximately $1,000 per year for incidentals, and then we aim to use the money left over for equipment and medical supplies for our patients. In addition to fundraising drives, Dr. Berliner has coordinated our fundraising efforts through word of mouth and community networking. We have many partners now, including Cedar Cares, Craig Hospital, the University of Colorado PM&R, Lanig Family Fund, Hanger, New Motion, Rose Community Foundation, Ivanhoe Foundation, Myers Family Clinic, and BKD, to name a few. For documentation, we had to develop intake questionnaires, consent to treat paperwork, and an EMR system. We used a platform that was free at the time called Practice Fusion for EMR, and personalized templates for our patient population to include easy multidisciplinary charting. We also developed several research metrics that I'll talk about a little bit later. Eventually, our clinic opened, and since its opening day in April of 2016, the RSVP clinic has been held once a month in the outpatient therapy gyms at Craig Hospital. We see between 8 to 12 patients per clinic day divided by 2 teams of providers consisting of over 10 disciplines, including occupational therapy, physical therapy, speech therapy, nursing, pharmacy, physiatry, psychology, prosthetics and DME services, rec therapy, interpreters, and social work. Our typical schedule consists of half-hour blocks of like specialties, such as therapy sessions consisting of some combination of PT and OT, speech when applicable, psychology, CCM, and med, which typically consists of a physiatrist, rehab nurse, pharmacist, and scribe. Wheelchair specialists, rec therapists, and prosthetists join therapy sessions as appropriate. So what does a day at our clinic look like? We now have over 70 volunteers and have graduated over 60 patients. We see patients from diverse backgrounds with a variety of diagnoses and needs. Our volunteers are incredibly dedicated, and our patients show incredible perseverance and resourcefulness. We do have a research arm of RSVP led by our research coordinator, Andrew Smith, supporting an improvement in quality of life for individuals after undergoing our rehabilitation program. I've included a list of some of the outcomes we've looked at in the past here, which included demographics, access to care, patient satisfaction, and a quality of life measure. In the future, we are hoping to compare our outcomes to TBI and spinal cord injury model systems outcomes and to have more generalizable measures. We have grown a lot through the past 6 years that we have been open, especially during COVID, when we had to learn how to do an all-virtual clinic, then a hybrid clinic, and now finally have returned to an all-in-person clinic. I'd like to end by telling the story of one of our very first patients. He was a 29-year-old male who had suffered a traumatic brain injury after a motor vehicle accident. His hospital course was complicated, including placement of an ORIF for a pelvic ring fracture and mesenteric and bladder reconstruction. He was uninsured, Spanish-speaking, and married with 2 young children. His wife was expecting their 3rd child, and he was the sole financial provider for his family. He was discharged directly home from acute care with significant deficits, including limited ambulation with a walker, significant pain, cognitive deficits, and vision impairments. We admitted him to our clinic, and after 6 visits with our therapy team, he had improved cognitively, progressed to being a community ambulator, was independent with ADLs, and had seen a neuro-ophthalmologist for his vision. He was also starting vocational rehabilitation. This patient is one of many who has fallen through our healthcare system's gap in care. There are currently 3 RSVP programs across the United States in Colorado, Texas, and Atlanta. We are currently in the process of forming national and international RSVP boards with the hopes of not only expanding our clinics across the nation, but also internationally, starting with the Rehabilitation Clinic in Honduras. We hope to inspire others to join this mission to make rehabilitation accessible to all patients with catastrophic injuries. Our goal is to provide a platform and roadmap for creating more free rehab programs and to raise awareness regarding the gap in care that exists in our healthcare system. Please reach out if you would like more information about our clinic or if you're interested in starting your own RSVP clinic. Over the past several years, we have put together a startup package and would love to share this with you and answer any questions you might have. Together, we hope that we can continue to grow the vision of RSVP across the nation and make ability for all a possibility globally. Thank you.